Hi, my name is Christina Morgan, and I am a member of our Healthcare Informatics class. I am doing my current event on patient-centered clinical decision support and its relevance today. I chose to tackle the subject of clinical decision support, or CDS, for my current event topic, largely because of the valuable role it can play in improving patient care. In this presentation, I will cover a summary of patient-centered CDS systems in healthcare informatics, the implications for healthcare that this presents, and why patient-centered CDS systems are relevant to nursing. So, a summary. What is patient-centered CDS? We know that CDS provides clinicians, staff, patients, or other individuals with knowledge and person-specific information, intelligently filtered or presented at appropriate times to enhance health and healthcare. That definition comes from our Nelson and Staggers textbook. In the article, The Imperative for Patient-Centered Clinical Decision Support by Marcial et al., that article says that patient-centered CDS supports individual patients and their healthcare providers in shared decision-making. The current model that guides CDS is more provider-centric and lacks input from non-medical sources. The keywords in the definition of patient-centered CDS are supporting patients and shared decision-making. So the focus of patient-centered CDS is different. So the healthcare implications. CDS systems have been around for over 40 years, and they haven't been adopted by all EHR systems. There's a lot of reasons for that. They can sometimes require additional data entry on part of the user that people don't want to do. Sometimes they can be cumbersome or expensive to implement with the tools and applications that they involve. But with that being said, patient-centered CDS remains the next step in improving patient outcomes. Let's remember the 5 rights of CDS. It's to deliver the right information to the right people through the right formats via the right channels at the right times. Patient-centered CDS says that the patient is the right person. They have the most to risk, to lose, and to gain through their treatment, and the evidence-based practices and research that's available to them and their providers, not just the providers. The right information includes more than diagnostic tests and information that's received from maybe a current inpatient hospital stay. The right information should include non-medical determinants of health, patient history, preferences, and values, because each of those items are going to contribute to how a patient cares for themselves and understands the medical information they receive, and how they manage their disease once they go home from the doctor's office or from the hospital. So, the relevance to nursing. Patient-centered research has expanded through the years. There's a lot of organizations that are involved in increasing the amount of patient-centered research that's available for us to learn from. One of those is called the Patient-Centered Outcomes Research Institute, or PCORI. This institute was authorized by Congress in 2010 to increase the amount of patient-centered data that informs stakeholders on all kinds of subjects. It ranged from blood pressure management to pain control and opioid addiction. I really recommend looking into their website if you get a chance. It's pretty fantastic. And now we know that patient-centered care is not just a lofty ideal, but a reality in many healthcare practices. And so let's think about the implications of using patient-centered research data in CDS systems, specifically in regard to chronic disease management and patient education. In regard to nursing, patient education could be much more specific to patient culture and preferences, or automatically include education for health problems or concerns reported in their patient history. That way we're covering the whole patient picture, their whole healthcare situation in one visit, instead of just focusing on what's current. And nurses are looking for this information too. In a study by Whalen et al., go ahead and check my resource list out so you can check these out. They analyzed nursing CDS requests and showed that the most frequently requested applications were those associated with risk assessment, risk reduction, and the promotion of healthy habits. Each of these involve patient-specific information provided at the right time to provide evidence-based care that is safe and will ultimately result in better outcomes. So thank you for taking the time to listen. I'd love to hear your comments on this on our discussion board, and hopefully we can continue the conversation there. Thank you.